Calquence is a name you might have come across if you or a loved one is dealing with certain types of blood cancers. It's a prescription medication known for its effectiveness in treating specific cancers, making it an important topic to understand. Knowing more about medications like Calquence can help you make informed decisions about your health and treatment options. In this video, we're diving into the top 10 facts about Calquence, from how it works to its potential side effects and everything in between. We'll cover what you need to know in a straightforward and conversational manner. So, let's get started. Number 1. What is Calquence? Calquence, also known by its generic name acalabrutinib, is a medication designed to treat specific types of blood cancers. This drug falls under the category of kinase inhibitors, which work by targeting specific proteins within cancer cells. The aim is to slow down or stop the growth of these cells, ultimately helping to manage the cancer. Approved by the FDA, Calquence is a trusted name in the world of oncology. It's prescribed to adults and has shown significant results in clinical trials. Whether you're new to hearing about this medication or already somewhat familiar, understanding what Calquence is and how it functions can be a crucial step in navigating your treatment options. Number 2. What are the approved uses? Calquence is primarily used to treat 3 types of blood cancers: chronic lymphocytic leukemia or CLL, small lymphocytic lymphoma or SLL, and mantle cell lymphoma or MCL. For those dealing with MCL, it's usually prescribed after at least one other medication has been tried. For CLL and SLL, Calquence can be a frontline treatment option. Understanding these conditions can provide some clarity on why Calquence is prescribed. CLL and SLL are both slow-growing cancers affecting the white blood cells, with CLL mainly found in the bone marrow and blood, while SLL typically affects the lymph nodes. On the other hand, MCL is a faster-growing type of cancer, making timely and effective treatment crucial. Number 3. How does Calquence work? Calquence works by inhibiting a protein known as protein tyrosine kinase or BTK. BTK plays a significant role in the growth and survival of certain cancer cells. By blocking this protein, Calquence helps to prevent these cells from multiplying and spreading, thereby managing the progression of the cancer. What's fascinating about Calquence is its targeted approach. Unlike traditional chemotherapy that affects both cancerous and healthy cells, kinase inhibitors like Calquence specifically target cancer cells. This precision reduces the likelihood of widespread side effects, making the treatment more tolerable for patients. Number 4. What are the dosage and administration guidelines? When it comes to taking Calquence, the standard dosage is usually one 100 mg tablet taken every 12 hours. Your doctor might start you on a lower dose and adjust it based on your response and any side effects you might experience. It's essential to follow your doctor's instructions carefully to ensure the best possible outcome. You can take Calquence with or without food, but always with a glass of water. If you happen to miss a dose and it's been more than 3 hours, simply skip that dose and take your next one at the scheduled time. Consistency is key, so setting a reminder can be incredibly helpful in maintaining your dosage schedule. Number 5. How effective is Calquence? Calquence has proven to be quite effective in treating CLL and SLL, as demonstrated by various clinical trials. In studies involving patients who had never been treated for their CLL, those taking Calquence either alone or with other drug called obinutuzumab showed high response rates. This means their cancer improved significantly or even went into remission. For patients whose CLL had returned or worsened after previous treatments, Calquence again showed strong results. These patients experienced better outcomes compared to those on other medications, highlighting Calquence's potential as a powerful tool in cancer treatment. The evidence supports its use and offers hope for many dealing with these challenging conditions. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. What are the common side effects? Like all medications, Calquence can cause side effects. The more common, milder ones include upper respiratory infections, headaches, diarrhea, muscle or joint pain, and bruising. While these can be uncomfortable, they often diminish over time as your body adjusts to the medication. Managing these side effects involves open communication with your healthcare provider. They can offer strategies to mitigate discomfort, such as over-the-counter remedies or adjustments to your dosage. Knowing what to expect can make the journey a bit easier and help you stay focused on the bigger picture, effectively treating your cancer. Number 7. What are the serious side effects? Although rare, serious side effects can occur with Calquence. These can include heart rhythm problems, significant blood disorders, severe infections like pneumonia, major bleeding, and even secondary cancers such as skin cancer. It's crucial to monitor for any unusual symptoms and seek immediate medical attention if they arise. Staying informed about these potential risks allows you to act swiftly and keep your treatment on track. Your healthcare provider will conduct regular checkups and blood tests to catch any serious issues early. This proactive approach ensures that any complications are managed promptly, maintaining your overall health and safety. Number 8. What drug interactions should you know about? Calquence interacts with certain other medications, particularly those that affect the enzyme CYP3A4 in your liver. Drugs that inhibit this enzyme can lead to higher levels of Calquence in your body, increasing the risk of side effects. Conversely, medications that induce CYP3A4 can reduce Calquence's effectiveness. Common inhibitors include certain antifungals and antibiotics, while inducers might include some anticonvulsants and herbal supplements like St. John's wort. Always inform your doctor about all the medications and supplements you are taking to avoid any adverse interactions. They can adjust your treatment plan accordingly to keep everything in balance. Number 9. What are the special considerations? If you have liver problems or are taking other medications that interact with Calquence, your doctor may adjust your dose. For instance, patients with hepatitis B might need a different approach. Additionally, it's important to know what to do if you miss a dose or suspect an overdose. Never double up on doses to compensate. In case of an overdose, symptoms are not well documented, but it's essential to seek immediate medical attention if you suspect you've taken too much. Keeping an open line of communication with your healthcare provider and following their guidance can help you navigate these special considerations effectively. Number 10. What are the alternatives to Calquence? There are several alternative medications for treating CLL, SLL, and MCL. Options include bendamustine, ibrutinib, obinutuzumab, and others. Each drug has its own set of benefits and potential side effects, making it important to discuss these alternatives with your healthcare provider. Sometimes, drugs used off-label can be effective as well. This means they are prescribed for conditions other than those they are officially approved to treat. Your doctor can help you explore these options and determine the best treatment plan based on your specific situation and medical history. Understanding Calquence and its role in treating certain blood cancers can empower you in your health journey, knowing how they work, their effectiveness, and potential side effects. This knowledge helps you make informed decisions and actively participate in your treatment plan. We'd love to hear from you. If you or a loved one has experience with Calquence, share your story in the comments below. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.